Hi, good morning. I'm Glenn Brown. I'm the invigilator for the OET speaking test conducting on 14 April 2020. May I know your name, please?
Hi, good morning. My name is Jeffrey Hotterson.
Can I have your passport, please?
Yes, sure. Here it is.
Can I have your candidate number, please?
My candidate number is 950352.
All right. We can now move on to the warm-up session. How would you handle a situation in which you couldn't read a prescriber's orders?
There will be some situations in which we couldn't follow the prescriber's notes. Mostly the experienced staff will be helping in these situations. Checking with the case note or relating to the scenario will lead to the correct conclusion. Sometimes seeking the help of colleagues will be helpful. In the toughest cases, consulting the prescriber will be the last resort. Whatever the case is, no assumptions will be made, because taking chances is not right and deserves no justifications.
What was your favorite clinical experience? And why?
My favorite clinical experience was dealing with an unconscious man who attempted suicide. He took poison and caused brain damage. The patient was very critical. We did our best and the patient survived, but he was getting respiratory arrest frequently. When he became conscious, he started to obey and respond positively to me. Why this becomes my favorite experience is that this case teaches me the value of care and affection.
Have you ever done any volunteer work? If so, what was it like?
Yes, during my last year of college days, as part of World Health Day, our college and hospital management organized a blood donation camp with the Support Community Health Center. Along with the hospital staff, few of my batch members were selected and I was one among them. On the day of blood donation, we helped the staff members in all the procedures which were assigned to us. This experience is memorable for me because it was my first experience doing volunteer work and I enjoyed it a lot.
How do you motivate patients?
The patient will be undergoing much stress during hospitalization as they're exposed to a new atmosphere. It is very important to keep them stress-free and calm, which will, in turn, reflect as trust towards the healthcare professionals and medications. Starting with a smiling face will build confidence in patients. Educating them about the present situation in a very calm and quiet manner in their own language will help them to understand better, and it helps to avoid chance for overthinking and relieves anxiety. Always try to make them optimistic with hopeful words and actions.
How do you set priorities in your work?
In the medical field, every single work has its own importance. Not a single action or work cannot be categorized with less priority. Hence, trying to finish each work on time is the best choice. However, according to the triage system, emergency situations are at most prioritized, one which needs early attention and care.
That is the end of your warm-up session. Now we can move on to cue card session. This is your task card. You have 3 minutes to prepare with the card. Your time starts now. All right. Time is up. You can now start your role play.
Mr. Robinson, I am glad that you came to see me. My name is Robert, and I am the nurse in charge of this clinic.
Hello, Robert. Glad to meet you.
I have been informed by the doctor that you will be traveling to some of the alien countries next month. Is that correct?
Yes, you are right. Next month I am traveling to Cambodia and Vietnam as a part of my work. I work as the international business manager of a company.
I see. How long are you going on the trip?
I hope that it will be for nearly 1 month.
Okay. Thank you for the information. The doctor has asked me to make sure that your vaccinations are up to date before you leave for the trip. Would you mind telling me about your immunization history?
Yes, of course.
Could you please tell me that when you have received the immunizations for tetanus, flu, and hepatitis A?
Well, I have not been fairly regular with my immunizations, but I remember that I have received a flu vaccination at the beginning of this year. As I do not maintain an immunization record, I can't accurately remember the rest of immunization. But if my memory is good enough, I can say that I was vaccinated against tetanus and hepatitis A and B in my childhood. To be more specific, it might be around 30 years ago.
Okay, I appreciate you telling me this. So, if I understand you correctly, you were saying that you have had a flu vaccine earlier this year and haven't received vaccines for hepatitis A and B or tetanus since your childhood. Am I right?
Yes, that sounds about right.
Okay, so, as per the WHO World Health Organization, Cambodia and Vietnam belongs to medium-risk countries. Since you are traveling there, I would advise you to update your vaccinations for tetanus, hepatitis A, and typhoid.
Oh no, do you think it's really needed for me? My company has arranged 5-star accommodation for me and I don't find any reason to get worried. I am sure that I have been managing pretty well all these years without any vaccinations, and now, to be frank, I cannot understand why I need to go through the hassle of getting these vaccinations again.
Yes, I understand your worries. However, it's important for the protection of your health and for your well-being. Immunizations are the first step for the prevention of diseases, and as if you are traveling to countries like Cambodia and Vietnam, there is a moderate to high risk of these diseases. From the conversation, I understand that you were vaccinated during your childhood and have been managing well, even though some vaccines need to be repeated after a few years, as those vaccines are not so efficient to act for a long time.
Really, I was unaware of that. I was with a misconception that those vaccinations that I took in my childhood are sufficient for a lifetime and I have lifelong immunity.
No, you need to update your vaccinations for tetanus, typhoid, and hepatitis A. A tetanus vaccination needs to be updated once every 10 years, and it's very important that you are vaccinated against tetanus because it is dangerous and even fatal. Now I can give you a combined vaccination for hepatitis A and typhoid, which immunizes you against these during the trip. Kindly make sure that you take a booster dose of it after 6 months.
So, you suggest that I should get these immunizations before traveling?
Yes, it is also important that there should be a gap of 2 weeks between your journey and vaccination.
So, I don't have much time left. I need to get vaccinations either this week or the next. Is that right?
That's right. So, I hope that you understand the need for vaccination to maintain a healthy life.
But, you see, I really don't like injections and needles. It's painful and uncomfortable.
I can understand your feeling of anxiety. Most of the people feel uneasy and hesitant about getting injections. But if you perceive the need for injection, then you will make the experience easier. The pain for injection is generally tolerable. You might feel a little pinch and some pressure only for a short time.
Alright, I don't think that I have any other choice. So, it's better to take it.
Are you willing to take these vaccinations today?
Okay, you can proceed with it. Anyway, I cannot skip it.
Exactly. I am glad that you agree. Kindly wait here for some time, and I will be back shortly with the vaccines.
That's the end of your speaking role play. Thank you.
Thank you, sir.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.